Accutane, it was hailed as a miracle drug in 1982, and it is still among the most powerful ways to help those with severe acne. But some have linked its use to depression and suicide and wonder why the drug is still on the market. A new study shows just how Accutane use may lead to depression. Researchers compared the brain activity of teens using Accutane to those not on the drug. They found the front part of the brain of those using Accutane had 21% less activity.
It plays a critical role in emotion. If there's a decrease in function in that part of the brain, then it would make sense that there'd be changes in mood.
Accutane now does come with warnings. Besides the risk of birth defects, the label says Accutane may cause depression and suicide attempts. Even though Roche, the drug manufacturer, claims there is no scientific evidence of a link. Since 2000, the FDA has recommended there be a formal registry of everyone on the drug to make it easier to keep track of side effects. It's supposed to begin in July. It has now been postponed.
Here we are 5 years later, and still no registry, still no certification of the doctors who are allowed to prescribe it. It's just a constant dragging their feet.
Congressman Bart Stupak has been a leading critic of Accutane since his teenage son committed suicide while on the drug in 2000.
We have scientific, medical evidence backed up by animal studies, backed up by other theories, and yet this drug remains on the market relatively unscathed.
Some doctors aren't waiting for government action. Manhattan dermatologist Bruce Katz stopped prescribing the drug a year ago.
A lot of our patients don't want it. They have heard about the possible side effects, the issues of depression and suicide, and they say, forget Accutane.
And Dr. Katz says there are other alternatives, like this laser photo treatment that can offer patients great results without great risks.
I think, given the alternatives today, I don't want my patients to be at this risk and deal with those serious side effects when there are safer treatments that we can offer them.
The FDA had no comment tonight on the reason for the delay in the Accutane registry, but they did say they expect it will begin later this year.